You're listening to BioTalk with Rich Bendis, the only podcast focused on the biohealth capital region. Each episode, we'll talk to leaders in the industry to break down the biggest topics happening today in biohealth.
Hi, this is Rich Bendis, your host for BioTalk and also CEO of BioHealth Innovation located in Rockville, Maryland. And we have a very unique guest today whom I met on the Life Science Advisory Board, which we both serve at the pleasure of the governor in the state of Maryland. She's located at Fort Detrick, Maryland, and it's Dr. Rebecca Fisher. And this is going to be one of the longest introductions of an organization that we're going to have on BioTalk at any time. Dr. Fisher, now Becky, is Deputy Director for Program Management for Congressionally Directed Medical Research Programs, better known as CDMRP, with Defense Health Agency Research and Development, Medical Research and Development Command. Did we get that all in, Becky?
Yeah, it's quite a mouthful, and we've shifted a little bit over the years, but that's our current moniker.
Right. Okay. Well, CDMRP is going to be how we're going to refer to you. And to be honest with you, I did not know a lot about this program until I met Becky on the Life Science Advisory Board and said, well, Becky, if I don't know, a lot of our listeners don't know about that. So we said, why don't we just do a podcast and you can educate everybody about CDMRP. So that's why we're here today. So thank you for joining. And Becky, basically, a lot of people would like to know about your history. How did you end up getting to CDMRP? So you're going to know that better than I, and it's better than going through a bio or a resume. Why don't you just educate the listeners on how you got to where you are today?
Sure, happy to. And thank you, Rich. I really appreciate BioHealth Innovation hosting us for this. It's always nice to have opportunities to share information and let people know more about CDMRP and the awesome funding opportunities that we have. So I am a former cancer research scientist. I have a PhD in toxicology. I worked at the National Cancer Institute. Actually, National Cancer Institute has a spot here on Fort Detrick, and that's how I came to know about the Congressionally Directed Medical Research Programs. I started with CDMRP back in 2005. I've worn a number of different hats with them. Currently, am really overseeing a group of CDMRP program managers who manage those individual programs that we are appropriated each year from Congress. So it's an exciting job. I love it very much. We have such an awesome mission that it really is great to be a part of.
And that's one of the reasons I thought it would be great to do a podcast with you, because you are extremely enthusiastic about what you do, which means you don't mind getting up in the morning and go to work. And I know there's a lot of people in their jobs that don't feel that same way, but CDMRP, let's talk a little bit about the organization, the program, the agency, and really primary mission, goals, objectives. And then we're going to go into a little more into the mechanics about some of the programs and funding that you do. But let's get that sort of the macro view of CDMRP from you, Becky.
Sure. So CDMRP is unique in the Department of Defense. We're not part of the regular defense budget, but Congress each year adds specific funding for targeted research areas. And we fund a very broad range of biomedical research. We received in FY26 $1.27 billion in appropriations for 34 different program areas. And also, in addition to those program areas, 2 of the programs have sort of nested topics. There were 72 topics called out for those 2 programs. One of them, cancer research, and all of those are cancer-related topics. The other is our peer-reviewed medical research program. That one is very broad and contains a wide variety of different topics. Congress sets those areas each year. Some are consistent, and we've been around since 1992 and have grown since then. The areas, some have been around since that time. Breast cancer was our initial program, appropriated in 92, 93. And then the different areas that are appropriated now really all share, even though they are unique in individual programs, they all share a common goal. Our mission is really to advance paradigm shifting research. We're looking for solutions that will lead to cures, improvements in patient care, breakthrough technologies, resources for clinical benefit, really not funding more research for research's sake. We're looking for innovative and impactful things that are really going to move the needle and transform healthcare. That's our vision statement, includes that. And it really is truly a part of who we are and our fabric of operations every day.
And basically, you talk about being a little bit different. Everybody's more familiar with NIH and their funding programs, especially the Small Business Innovation Research Program, SBIR. There's a relatively new agency, started 4 years ago, ARPA-H, which is part of HHS, which has started. We've got BARDA, we got DARPA. So how does CDMRP really differ from all of those, and so that it's not what we'd classify redundant funding opportunities in the federal government?
Yeah, that's a great question. And I like to frame it as we're complementary, right? We're not only different from other department funding. So within the Defense Health Agency, there's Defense Health Program funding that we call kind of core funding. Those areas operate on very specific requirements that come from the department. And then we also work very closely with those folks. We work very closely with NIH, with the VA, with CDC, with ARPA-H to help shape the strategies. We all get different types of funding, if you can imagine. And so we have different flexibilities with our funding mechanisms than they do. ARPA-H is primarily funding OTAs, what are called other transactions. NIH funds a broad range of things. We work so closely with them. We have them sit on our panels. We also help review for them so that vision on what they're funding and what we're funding helps us shape the strategies so that we can say, hey, maybe you're taking this early stage research, for example, and we're going to pick up translational parts of the pipeline or clinical. It depends largely on each program area that is allocated to us and how much dollars really are put there each year. So I'll give a good example. ALS is the amyotrophic lateral sclerosis research program for CDMRP, started, I want to say 2007-ish. And I think they had about $7 million. And for many, 7.5, something like that, for many, many years, that program filled a gap, a niche in the federal landscape and even the private, the nonprofit funders landscape of funding that accelerated research in the translational space, squarely in this very focused, pulling things from the basic area and propelling them. And NIH was picking up a lot of the clinical funding, and industry would pick up a lot of the clinical studies. We didn't have enough money. $7 million is not enough money to do that. Currently, the program for FY26, Congress increased the funding based on some of the excellent outcomes that were happening with our projects. They said, hey, it looks like we can give you more money to do more clinical work. So a couple of years back, they increased it a little, I think, to $20 million. And we were funding some pilot clinical trials and things like that, moving more into the clinical space. Now, this year, we have $40 million for the program.
Wow.
Yes. And it looks like if you look at the House language for next year, there's a potential for that to go up even more. The House had 80 million. So we're looking at wonderful increases, and then that increases our capability to do clinical work.
Right. And your annual budget is very comparable to a number of the other agencies we talked about. The SBIR budget at NIH is about 1.4. ARPA-H is around 1.5. You're 1.3 almost. So, yeah, I think it's a very robust budget. And I guess when you say translational, would you say that you're more focused on applied or advanced research than purely basic research that a lot of the other agencies do?
Yes, I would say that is true. Even if a program is funding earlier stage work, more basic work, we're going to challenge the investigators to draw a line to that translation. What are you trying to do? Where are you trying to go? You need to have a vision for that. And we ask for that. We will ask for those statements in the applications.
Okay, great. And I think one of the things that I've heard from you is that what's unique about CDMRP is the consumer involvement. And talk a little bit about what that really means, consumer involvement in your programs.
Yes, that is truly what we call our true north, consumers, or people who have lived experience It can vary with the particular program area. These are folks who may be patients, they may be family members, they may be caregivers. They provide such a unique perspective and keeping our feet to the fire, as it were, and also helping really improve the strategies that we have. They participate at all levels, initially helping set vision and strategies on our panels. They also participate in the peer and the programmatic review level, really evaluating how impactful is this to the community that it's targeted to help. If we're just scientists and geeking out on a great idea, that's one thing. It's really neat to know, but is it going to actually help someone? And so that's where consumers can really help bring it home.
Well, that sounds like a very unique element that you don't see involved in a lot of other programs. And it's really getting closer to the patient, really.
Absolutely. We also have 19 of our 34 programs have mechanisms, funding mechanisms that encourage or even require in some cases for some of the clinical work to include consumers as part of the research team. This isn't tokenistic. This is actually helping with the investigators side by side, doing the research, planning the research project, and submitting the proposal. So that level of engagement, we see great improvement in the impact of the work ultimately.
Yeah, I know a lot of people would applaud your patient advocacy element of your program. So
absolutely.
You mentioned AOS and cancer, two areas that you're funding research on, but you say 34 and then two of those have 72. So there's a broad scope of the different things that you're interested in exploring to fund or make investments in. Can you give the listeners a sense of the types of diseases, conditions, research priorities across your whole portfolio, which is so broad?
Yeah, absolutely. Our cancer research programs, we have a significant number of those. Like I said, starting back in 1992 with breast cancer, prostate cancer, ovarian, a large swath of different cancer programs. The neuroscience, neurodegeneration is another area where we have a traumatic brain injury, we have psychological health, we have MS, multiple sclerosis, the ALS, as I mentioned earlier, a number of different areas there, autoimmune disease disorders and immunology, kind of that area, lupus, for instance, infectious diseases. We have a tick-borne disease research program and have other respiratory health that's funded under the peer-reviewed medical program. Internal medicine, cardiovascular, the respiratory health areas are largely funded under that peer-reviewed medical. But of course, the relationships across programs are always there. Rare diseases and conditions, things like Duchenne's muscular dystrophy, tuberous sclerosis complex, things that, neurofibromatosis, things that people may not think about the department as funding. But these are all areas where across the board, you look at ways that the military health system is involved in ensuring readiness. So family members are very much a part of that readiness. I'll give an example, autism. Treatment for children with autism really is reliant on a stable relationship with a care provider. For military members who have to move on a frequent basis, they may pick up and move every few years. The types of therapies that may be more helpful in that population are things that we're looking into. How can we do more remote care and things that would be more helpful and more stable for that group? So you'll see a lot of ties that may not be obvious initially. A lot of the cancers, for instance, are areas where military service actually increases your risk of cancer. It increases your risk of ALS and multiple sclerosis and a large number of these other areas. So trying to get a better handle on that and really looking, like I said, we're very interested in treatments and helping people.
Yeah, with this broad approach, NIH has 27 different disease-specific institutes. You cover the whole spectrum with your umbrella, which means that people who may be interested in exploring really need to go to your website or other areas to see the breadth and what might be open funding opportunities that you have now. Talk a little bit about the open funding opportunities, how that works. And I know we'll talk later, but again, right now, how does someone find out about all of these opportunities and what's open right now?
Yeah, absolutely. So the best place I think to go, I would direct you to our website, cdmrp.health.mil. Super easy to find. You can just Google CDMRP and you can find it. And each year, our programs, so we get the yearly appropriation from Congress for these individual programs. Each year, each individual appropriation, we develop a vision setting strategy for that. So, how are we going to execute this to get the biggest impact for these dollars for this year? Those funding opportunities get posted not only on our website, but on grants.gov. So you can always find them there. That's the official copy, and that's where the applications get submitted. You will submit a pre-application on our website. So on our eBRAP website, the funding opportunities are largely called program announcements. This means the awards end up being grants or cooperative agreements. Those are a public purpose assistance mechanism, if you're familiar with the contracting world. So these are not contracts or OTAs to the largest extent. We do have a few that end up being contracts or OTAs, and those are largely in from our broad agency announcement funding opportunities that go out. Just a few programs will release those, and it's maybe not even every year. So military burn, traumatic brain injury, combat readiness. And the reason for that is because of their close ties to the core DoD requirements-driven areas and some of the transitions we're able to push for those.
Now let's talk about the range of these grants or the cooperative assistance. So, what might be some of the smaller ones? And you already mentioned $40 million or large numbers, but what's the typical range for some of the awards you're going to make?
Sure. So the range can vary greatly. It's going to depend on the type of program you're applying to. A smaller program with fewer dollars may fund earlier stage research, such as we call them discovery awards or concept awards. They're meant to fund ideas that may not have preliminary data yet. And that's okay. We want to test your innovative new ideas out in these forums. Other areas will grow as the research matures and as the programs maybe have more money to invest. They'll spend money in what we call idea awards or investigator-initiated more awards, applied work. We also then transition into that translational space. I'd say we have a large number of programs that probably the majority of our programs have something in that translational space. So if you have a product that's maybe very early stage and you're looking to push that along, it's a great way to get additional funding to help you get there. We also fund up to phase 3 clinical trials in some programs. So especially the peer-reviewed medical, which is our largest program, has a lot of funding, and they put out a clinical trial award every year, or they have. That award mechanism can fund any phase clinical trial. So you really have a lot of opportunities there, depending on where your product is.
Yeah, so basically, from a size standpoint, does that mean the smaller ones would be what, $500,000 or smaller than that even?
Some of them, I think the smallest award is probably around $200,000.
$200,000.
And that's for probably an 18-month period of performance. The period of performance can shift, obviously. And your clinical trial awards, some of them have no cap. Some of them have a cap, 5 to 10, who knows? It depends on the program.
Right. Yeah. That's quite a range, and also having the ability to stay with something, as long as they continue to progress and succeed, you might have the opportunity to get multiple awards, correct, Becky?
Yes, you can have the opportunity to get multiple awards. I will say one of the great things about our funding, and I think NIH is doing some of this year, folks who had our awards, so we obligate all the funds for the entire period of performance up front. So what that means is you don't actually get the funding all at once, but it's there, it's available, it's in an account that is tied to your award. So you just invoice against that account and it's protected. It's not money that if we get cut, if the program gets cut next year, like we had some cuts last year to programs in FY25. But all of the awards that were made continued without a blip because we had the money in the accounts already. So that's a good thing for you as an investigator to have that assurance. And I think it's really fantastic.
Yeah, it's great to have that predictability and long-term planning, really.
Absolutely.
We're talking to Dr. Rebecca Fisher, or Becky, who's the Deputy Director for Program Management at the Congressionally Directed Medical Research Program, CDMRP. Now, we've talked about the size of awards, the types of diseases or medical devices or things that you fund. Talk a little bit about the review process, the application process, how long the review process takes, how long does it take to actually get an award, what percentage of the grants or applications that are applied for actually, or do people win? How's that compare with different agencies, Becky?
Yeah, sure. Like I said before, each individual program is going to tailor their investment strategy to meet their goals. So they're going to consider things like the congressional language, the input from different key stakeholders. And some of these programs will actually have stakeholders meetings. And so you'll have an opportunity, the community has an opportunity to input. They consider where are the research gaps, where are the funding gaps, what are emerging technologies and opportunities. Basically, those applications addressing those key points, and those key points are all outlined in the funding opportunities. So that vision goes into the funding opportunity outlined in the beginning, and really having the opportunity to tailor your application to meet the request that are outlined in that funding opportunity. And it may differ from program to program. So that's one of the best, I think, tips I could encourage is take a little bit of time, get a cup of coffee, sit down, read really carefully through the program funding opportunities, the ones that you're interested in. And we have a bunch of them open right now. So I think it's a great time for you to get engaged in this and to see what opportunities are out there that might align. The review process is what we call a 2-tier review process. It involves an initial step of peer review, which is very similar in some ways to what NIH does. However, we do not have standing review panels. It's one of the big differences. We convene a review panel each year for each funding opportunity and program area. So there might be some familiar faces that get shuffled around, but the panel itself is not a standing panel. So every application, we don't do resubmissions either. Every application is a fresh application. There's not the ability to speak with a program officer to tailor your work to fit. Everybody gets a fair and open. Our idea is that the information that you need is in that funding opportunity. So that first step of review, the peer review, scientific and technical merit, each individual application is weighed and graded essentially on its own merits compared to a gold standard. And this stage involves consumers. So know who you're writing to. Make sure that when you prepare a proposal, you're including that audience as part of how the impact might flow from your work. The second stage of review is what we call programmatic review. That's where we have also consumers, but policy people and other scientists in the area. And the programmatic panel's job is to weigh across all the applications that scored. We generally look at the scores from peer review and those that scored well there. So that's step one, score well at peer review, the technical merit. And then you get to programmatic and they will take a look at the top scoring ones, largely from the peer review, and weigh them against each other, sort of saying, okay, well, the program goals are this, and maybe we have 5 proposals in one area, and then we have one proposal in this other area that's not really well addressed, and maybe it didn't score as well, but we're going to fund that one because we really need something that it also addresses this program goal. And so I always tell people go to the edge of the light. That's where your work should be, not in the middle where everybody else is, but go to the edge of the light and look for innovative ways to push that out. And I think that's at least just general advice on thinking about your work and how you can have more of an impact. And that's what across all the CDMRP programs we're looking for. How can we increase impact? How can we not just make incremental advances, try to push things a little bit further, faster?
Great. You actually hit on my next question. It's really what really makes a strong application stand out. And that's really the edge of the light, as you're talking about it. But what are the most common mistakes or things that really prevent people from progressing with CDMRP?
Yeah, sure. I think you find, and it's just common mistakes, some things are just being on time. We had a couple yesterday that came in and they missed the pre-application deadline. When you don't start until 4:30 and it's due at 5, well, that's kind of hard. If you have a technical issue, that's not our fault. So that's an easy one that it still trips people up. And I get it, but it's an easy one to fix too. Just start early, have other people read your proposal. Get the broad audience. It's not always, if you're drowning in jargon, other people can't understand it. Make sure your message is clear and compelling and actually shows how you're going to make an impact. Show that you've thought through some contingencies. Research isn't perfect. It's why they call it research. We've got to do the work, and sometimes it doesn't work out perfectly. Anticipate and show that you thought through some of those things in your proposal. I think that's very valuable. Make sure that you demonstrate that you have access to the resources that you say you need. If you have a specific subject population, make sure there aren't 5 other clinical trials in the same area doing the same population that you might have struggles recruiting. Think through those things, do your homework, and show that in the proposal. I think those are some common areas we see.
Thank you for that good advice. The listeners will pay attention, hopefully. But when we look at NIH, ARPA-H, CDMRP, basically, do people sometimes submit applications to all 3 or multiple agencies simultaneously? And how does CDMRP really view that when people are going to multiple agencies with similar proposals simultaneously?
Yeah, it's a great question. So we actually have linked databases behind the scenes. You guys don't get to see that, but we work with NIH. We have a portal and NIH hosts it, but many other federal groups use that same, it's called QVR, Query View Report. Innovative name there, but I don't know how that came about. And it allows us to see all of the proposals that are in the system in NIH, at the VA, at the CDC, and ARPA-H. ARPA-H, we don't see their proposals, we see what they funded, but we coordinate very closely with all of these groups. We have representatives from different areas as relevant to our programs who sit on those programmatic panels. You can actually see who's on our programmatic panels on our websites. So it's another good tip. That's your audience for your programmatic review. Those are the folks who are reviewing and recommending what gets funded. You can't reach out to them, but you can at least know your audience.
And then some programs in different agencies are geared to small businesses. Others could be partnerships, large and small, working together. Some are for academics. How do you look at your portfolio? How is it balanced between small business, big industry, academic researchers, or other categories of people applying for your awards?
Yeah, that's a great question. And for us, we're open to all comers. It's really about the idea. It's not as much about where it's coming from. However, industry, and especially small business industry coming up, we really value that because we understand you're in it for the same mission we are, to get the product to the people. And so we're very open. Our eligibility for all of our award mechanisms, it's spelled out in each individual funding opportunity. And the vast majority of them are open to academia, industry, even other government, and within the DoD and the VA are allowed to participate. And I think that's one of the unique things too about CDMRP, being able to fund those partnerships. We can fund you if you want to work with a DoD lab to do a study, DoW lab, excuse me. We can fund you if you want to work with a DoW lab to do the work. We can fund you if you want to work with the VA, a VA researcher to do the work. We can fund you if you want to work with an academic to do the work. So industry can partner and we can fund those partnerships. And I think that's an incredibly valuable thing for CDMRP. It also helps. We see academics who maybe are too much in that basic space, and we're trying to drive them more towards delivery. And how do we do that? And partnering with an industry partner helps, again, make that real. This is why the consumer engagement in our programs is so valuable.
I'd say flexibility sounds like one of the key benchmarks for CDMRP, right?
Yes, absolutely.
Yeah. And then with some agencies, they have specific times of the year where they have calls for proposals. The SBIR program at NIH is January 5th, April 5th, and September 5th. And then Do you have specific times where you have your funding opportunities available during the year, or is it random?
That's a great question. We are dependent on the defense budget being passed. So once that bill is signed, then we can put out funding opportunities. We can't put out opportunities in advance of that. And that's a CDMRP. That's a unique feature of being added to the budget. We're not a part of that core request. We're added. Once we get, and we usually will watch the language, like I said, coming out, but we're no guarantee till the ink is dry. When the ink is dry, we'll start releasing. So that can be, so for this year, we had a signed bill in February. We started releasing. We had a little bit of a delay because there's some extra review steps now, but we started releasing funding opportunities in May, I believe. So we were able to get some going. Normally we'd be a little bit closer to the bill being out. So watch for that.
So basically, they should go to your website on a frequent basis or grants.gov.
Yes.
To monitor to see what new opportunities are emerging.
Really sign up. There's actually a sign up on our website.
Okay.
Where there's a listserv. It's not going to spam you with lots of things. Trust me, I'm on all of the programs, so I get them all. But you can sign up for individual program areas if you're interested. You can sign up for all of CDMRP, and it will give you a heads up when we release. So when the bill is signed, we'll go ahead and release what we call pre-announcements or anticipated funding opportunities. We're posting those now on grants.gov as well as our website. So there will be two places that you can get heads up. Here's what's coming. There's going to be a funding opportunity, and here are the areas that it's covering. That's very helpful. And if you sign up on the listserv, you'll get notifications of when those are published. And I think that's very helpful. Let you plan ahead. Then you can start gathering your things before the actual funding opportunity hits the street. And yeah, I think that's fabulous. And then when it does hit the street, there's another announcement that goes out that says, hey, it's here. So if you want to sign up for that list, I really encourage that. Otherwise, you can check. Just continue to check.
And is your annual budget this year, say $1.27 billion, is it use it or lose it before September 30th, or do you have the ability to carry over? Or do you manage that by making multi-year commitments for projects that are not going to be able to be accomplished in 1 year?
Yeah. So for us, what we will do, so our funds fall in the what they call RDT&E category. So it's research, development, test, and evaluation.
Okay.
All we have acronyms, another acronym. But essentially, it's what they call 2-year money. So for the fiscal year $26 that were appropriated in February, that's late, right? It should have come last October, but it came in February. Those dollars we have to have appropriated by 30 September 2027.
Okay.
So that's why our funding opportunities that are open right now will be funded with those FY26 dollars. And when you get an award from us, we obligate all that money at once for the entire period of performance, because we can't guarantee that we will get that same program back next year. Some programs have continued for many years. Some are hit or miss. So again, it's a tumultuous environment right now and no guarantees. So we fund it, we obligate it all up front. So congratulations if you get an award. It's good for you.
It's been an interesting year, to say the least, for everybody.
Yes.
Really? Okay. Enough said there. We've covered a lot of ground here, Becky, in this short time for this podcast. Is there anything that we haven't covered you think would be beneficial for the listeners to hear, or something I didn't ask you?
No, I thank you for having us. I think check our website for the latest in the open funding opportunities. You'll see a little ticker there that has all the open ones listed. If you go under the funding opportunities tab, you can always find us on grants.gov. And there are a lot of good resources on the website. There are links to the how to apply videos that kind of walk you through a little better than I could here, give you a little more information and some tips on how to apply. And then also more information, more details on our 2-tier review process. So that's there. There's an FAQ there because we get the questions and we try to make sure that folks are informed. If you ever need anything, you can reach out. Our public affairs contact information is there. If you have questions, they'll ping me occasionally. I can follow up if anybody has questions. and really just appreciate you hosting and allowing me the opportunity to share a little bit more about CDMRP with the group, because I know we're not as well known as NIH and, ARPA-H and NSF, or maybe not the big flashy ones, but hey, we have some really important areas of research to fund. We welcome industry funding. We welcome industry partners and absolutely want biotech and young and new and old industry folks to take a look at CDMRP. And if there are areas of interest that align with your work and you can tailor your work to fit the program goals that we have, we welcome you to help us meet our mission and really deliver products to people. We want to get much faster, much better at this. It seems like sometimes research takes forever. And so we really appreciate your help. And I think one of the things we would also welcome are input from you on how can we do this better. And I don't know, Rich, we've talked a little bit about this before. There are ways that maybe what is it that industry needs the most? What are the biggest hurdles that you have? Are there ways that we can facilitate, maybe not directly, but through specific funding opportunities, how we offer the funding opportunities? Are there other ways to go about this? So I think many of you share the same mission, trying to get products to people, transforming care for people. And we welcome your input and your help to do that.
I was just thinking while we've been talking that one of the things I forgot to ask you is that if you want direct input, we're going to have our 12th annual BioHealth Capital Region Forum in Rockville, September 15th through 17th, and we're just finalizing our panels. I'll follow up with you offline to see if you might be interested in being a panelist, because we have a federally funded panel that we're putting together right now. And I've got ARPA-H and NIH and SBA, but CDMRP, and you would be a great addition to one of those panels. So we'll talk offline if that's something you might be able to get permission to do, to make an appearance, to have direct interaction with some of these people you'd like feedback from.
Absolutely. Thank you. I appreciate it.
Okay. This has been very enjoyable. I've learned a lot myself about CDMRP, talking to Dr. Rebecca Fisher, Becky, who's the Deputy Director for Program Management for Congressionally Directed Medical Research Programs, with an annual budget of $1.27 billion that a lot of our listeners did not even know existed. So, Becky, thank you for being on BioTalk, and hopefully we can do a follow-up with you sometime in the future and maybe get to see you in person in September.
Thank you. Thank you. Look forward to seeing some great applications.
Thanks for listening to BioTalk with Rich Bendis.